So that is the basic definition of it. And when we think about high blood pressure, I know a number of us know how we measure that at home. You have the top number, you have the lower number. I thought to actually explain what these numbers mean. So the one at the top is our systolic, as written here. So it's our systolic pressure. In simple terms, it's the pressure within these blood vessels when your heart is contracting. So think of your heart like a muscle. It is a muscle. So when it's contracting, that's the systolic pressure. And then when it relaxes, that is your diastolic. That's the number at the bottom. Okay? So it's contract, relax, contract, relax. We've got the normal ranges, which we'll talk about later, but that's generally what happens. So the pressure in your blood vessels as your heart is contracting and relaxing is what is recorded in your blood pressure monitors. Okay. Now, some people call hypertension the silent killer. And that is because it's a common, high blood pressure is common within England, across the world, it is common. The statistics show that about more than 1 in 4 adults actually have it, but not everyone know they have it. And for some of my patients, we actually pick it up incidentally. I mean, someone came in, I saw a patient last week for something totally unrelated. And I just, as routine, let me just check your blood pressure, make sure your observations are fine. And then we noted, blood pressure was really, really high. So it's not one that manifests, with symptoms all the time. And that is why it's known as a silent killer. It's known as the third biggest risk factor for premature death. And that is again because it is a silent killer in the sense that symptoms don't always show up. So if you don't check, if you don't know, you wouldn't know. And then some people end up dying prematurely as a result of high blood pressure. And then also it's known that at least half of all the heart attacks we hear about, strokes, a lot of that is always associated with high blood pressure. Allow me to use high blood pressure and hypertension interchangeably, but it's the same thing I'm talking about. And I'll tell you how we go from high blood pressure clinically to hypertension. High blood pressure is when the value is really high. But I won't see you in clinic and see your numbers being high and just say you have hypertension. No, there are certain guidelines we need to go through to actually confirm that you have such consistent high blood pressure. So we'll possibly send you home to give us readings over 7 days, for example, morning and in the morning and in the evening. And then we work out an average in about a week's time and then see what your numbers are saying. And at that point, we can decide to also do a few other tests to rule out other causes of what could be raising your blood pressure. And there are a number of reasons. Now, there are 2 types of hypertension. We've got the primary hypertension, and then we've got the secondary. Now, with primary hypertension, a lot of people, almost 90% of the cases will fall into this category where there's no sort of identifiable cause that, this is what has particularly triggered it in this individual. The secondary option is when people have, underlying kidney diseases, for example. For some people, they've got endocrinology problems or vascular problems that they already know about. That could sometimes contribute to getting hypertension. So that is a secondary cause where there's something underlying, as in kidney, endocrinology, or vascular, or medications. I'm talking more about illicit drug use here that could cause people to have high blood pressure. So those are the two types, but most people generally fit into the primary one as well. Now, risk factors. When it comes to understanding what could be causing, what could be the trigger to it. Remember, I said there isn't a clear, especially in the primary one, it's not always clear cut. But what we know based on research over the years is there are risk factors that make you much more likely to have raised blood pressure. And then it's divided into two categories. We've got one category that is non-modifiable. It's just the way things are. And based on research, people that fall into certain things we'll talk about in this non-modifiable area are more likely to have hypertension. And then we've got the modifiable factors, which are things we can actually do, they're things we can almost correct really to try and help things get better. And we'll start with the non-modifiable option, your age. So the older we get, the older and wiser, I like to say. The older and wiser we get, research shows that people are more likely to have raised blood pressure the older you get. And then for some, there's also the gender influence on there, where typically when you're less than 65, the research at the minute shows that actually most times men tend to have it more than women. But then the older we get beyond 65, it sort of flips over where women are more likely to have it at that age more than men. It's not saying both genders cannot have it, regardless of the age, but gender plays a huge role in it. Ethnicity, and interestingly, we're talking in this community about it. Based on research, those in the Black African, Black Caribbean category are more likely to have high blood pressure. And then genetics, and someone asked about this, is this hereditary? Genetics has a huge role to play in it as well, which is why, for example, when you come to see us in clinic or we're talking to you over the phone as in a teleconsultation, if we're asking about, is there anyone in the family that has any medical problems, that is where it comes in handy. Because if we know that there is a genetic element of it where, grandfather had something, father had something, or mom had something, then that would also influence to an extent, not at the initial stage, but later on, it would influence the sort of investigations we need to start thinking about. Is that the point we need to think about referral? But obviously, we need to consider the range of medications you've used, because we have to exhaust quite a few. We can treat this in primary care, as in a GP setting, and just follow you up. And as long as you monitor things the way we tell you to, or the way we advise you to, use your medications, is something that can actually be managed in the community. It's only the severe cases where we've exhausted quite a range of medications, then would need to refer you on to, the cardiologist in hospital for any specialist input. But genetics plays a huge role, and it's important when you're telling us about it, about what you're experiencing, because like I said, it helps our management. Okay. And we've got the modifiable things. So things we have control over to an extent. One, salt. Salt. I know how we like to sprinkle salt a lot in our different foods, but we need to be mindful about this. And for some people, in terms of trying to clarify what impact salt has. So generally with salt, when you put salt in an area, essentially you have water come towards the area that has the salt in it to try and dilute it out, okay? So when you have a lot of salt in your bloodstream, let's think about this pipe again, right? When you have a lot of salt, this pipe is already trying to flow through as normal, as much as it can. The blood is trying to flow through. And then you bring salt in. That means it will attract more fluid. So you have more fluid being pumped into this pipe. And that is what would increase the pressure in that pipe in your arteries. Okay? So I'm not saying cut out salt completely. No. For me, doing things in moderation is important. And I'd say be mindful, really. Keep a close eye on it. If you know that you use quite a lot of salt, it's something to be mindful about, really. And just monitor that. And also, poor diet, the kind of things you get to eat. And along that area, really, we'll be thinking about, cholesterol will be my main issue there. A lot of us like to pour oil, in our soup, in a lot of our meals, or we fry a lot of things. I'm not talking about your air fryer now. I'm talking about you pouring quite a lot of oil in the frying pan, and then, how you like, some of us like it. But we need to cut down on that as well. For some people, it is the increased cholesterol level that could contribute to raised blood pressure. And what I mean by that, and I think I have a picture. Yes, okay. I'll come back to this, but essentially with fats. So when you eat a lot of fatty foods, so this bit here, right, let me see if I can, okay. So this bit here is your normal clean pipeway, your artery, lovely, clean, nice. The older we get, naturally, we might begin to have some plaques, from fatty foods we eat. It's just a natural thing that happens the older we get, which is why we encourage exercise to try and burn off all the fat as much as possible, because otherwise they get settled in the inner lining. And again, that could cause narrowing in that artery. And so your blood is not able to flow as smoothly. You to encounter a lot of obstacles while it's flowing. Okay, so with your fats, it's likely to cause deposits, which will slowly build. And like it is here, you have your fatty material deposited there. So look at the difference between this clean pathway. Now we've got a lot of fat accumulated here. And then what it could eventually lead to, not in all cases, but I'll tell you why this could happen later, but it could eventually get blocked. So it could either be very narrow, or it can get blocked. And that is where for some people, there's a talk about blood clots, for example, which there's a whole science to how the blood clot forms, but that is what could eventually happen, going from this clean pipe here to this right here. I'm not trying to scare you, but I'm just being realistic, trying to share, what could actually happen. So that is where the diet side of things comes in. So being mindful of what you take in. So I've talked about your fatty foods, caffeine as well. Caffeine is known to also contribute, really. And in terms of how it contributes, it would be similar to, it would be similar to what smoking would do as well, which is, it gets your system very, very hyperactive, and your system is trying to work at a really high pace as well. And this is with a lot of caffeine. And then your body is saying, but this is not the standard level of blood I would like to pump through. But no, because of the caffeine, because of the nicotine in the cigarette, it just causes your body to act in a hyper mode, as it were. And then that can cause extra pressure, on the system, and that could also contribute to raised blood pressure. Okay, obesity as well. Again, it's all in the same sort of concept, in that with obesity, your body feels like it needs to work a lot more harder, especially your heart muscles. It's having to work a lot more. It's increasing the pressure because it has to, with obesity, you've got, for most people, extra areas of fat, extra areas of muscles, but they all need blood from the heart to function. So your heart needs to now work extra hard to try and distribute to every area in your body. So that is causing more pressure on your heart to work a lot harder than we need it to be working. Okay. Excess alcohol consumption, again, is also a risk factor that can contribute to high blood pressure. Lack of physical activity. So you're just there, you're not doing a lot of activity. Remember what we talked about, activity helping you burn off some of the plants, the fatty bits there. That is what it can do. So encourage yourself. The protocol we advise at the minute is 30 minutes of brisk walking if you can in a day. That would be fine. If you can go on a run, if whatever you can do, but just make sure you keep moving. For those of you that like dancing, keep moving. Utilize your dancing as an exercise, but I'll talk more about that later. Generally, stress, mental health, stress, all of that can cause low socioeconomic status as well, can also have an impact. But again, this is tied in with mental health and stress. What I've realized in clinic is a lot of us underestimate what stress can do to us, what stress can do to our body, whether it is our heart, whether it is your abdomen, so your gastrointestinal function. Some people just end up having cramps, but a lot of it is due to stress. And even down to, for some women, stress has an impact for some people on even your menstrual cycle as well. Stress has a huge impact on us. And what I've also come to discover is it's not necessarily the stress you think is showing on the outer, like showing outward to everyone. No, there are some things that might be lingering on your mind, maybe an exam coming up. And stress can be positive and negative as well. Okay, so if we're thinking about stress, it could be, you're looking to get married, for example, and the preparation for that, or you have a party coming up. It's positive, but it can have an impact on you in a number of areas. So I think a key lesson would be, let us not underestimate what stress can do. Let's look for ways we can relax. I know it's easy to say, but we need to try and practically do something to try and cut down our stress levels, because that would again have an impact on how you are as a person, how you function, not just for your heart, but for every other organ in your body, really. Right, so in terms of complications, let me just see if there's anything. I love that. Stress can lead to gray hair. Yes, as well. Yes. Okay. Right. Okay, I will come back to that. Thank you. Keep the questions coming, the thoughts coming. Yes, so in terms of complications, really, with this raised blood pressure, I think I've touched on the fact that the major one, or one of the major ones we'll be worried about, is us going from this clean, lovely cross-section that I've got up here to having this happen. Now, when the lining of your artery is filled with different things and then it gets blocked, that is where people have things like heart attack. Heart attack, essentially, an area, so a part of the heart, remember I said the heart is a muscle. So that part of the heart not having the blood supply it should have, yes? And then all of a sudden, things just shut down in that time because the heart doesn't get the blood supply it needs in that time. Again, this is what can lead to stroke. So some people have stroke. So think of, for example, you've got blood supply, so you've got your arteries going up into your head. If you have one of it that gets full like this, completely obstructed like this picture, there's no flow. And that is where people have stroke manifest. So that is why we say there's a huge link, typically at least over 50% of the cases, between stroke and raised blood pressure, and heart attack as well, and raised blood pressure. And the other things that could also happen would be things like heart failure. Now, heart failure, remember I talked about if you increase the pressure, if the heart is beginning to overwork, think of you trying to, when you're trying to clear up your sink and you're trying to make you work extra harder so that things will flow through in the pipe. If it gets to a point, and it just gets weak and is not contracting as much as it really should, that is when your heart failure comes in. When the pressure, everything is just too much. So remember, it's a backlog. So your pipes, the pressure is a lot there. And then within the heart, it's like, I can't take this anymore. And then, it just gives up. For some people, the muscles in the heart, and this is the whole system around heart failure, it's a gradual thing. It doesn't happen overnight. The muscles in the heart, for some people, it begins to get a bit thicker, trying to compensate for all the work it's doing. Then next thing, the heart begins to try to stretch, to enlarge beyond what it should be, what the dimensions it really should be, it should be within. And that's when you have people having things like, enlarged hearts, cardiomyopathies, because the heart is trying to compensate. But when it does all of that, the muscles have gotten thicker, the heart tries to get, bigger. It gets to a point where it's just like, no, I don't have the energy for this. And then, all of that leads to sort of advanced heart failure, really. In terms of complications, again, remember, we're thinking about the blood supply, the arteries supplying the kidneys, they might not function as normal. And then you have, complications around that as well. So kidney diseases, and then dementia as well. Again, for some people, again, back to that flow of blood in the vessels, if it's not going in the right flow to the brain, dementia begins to kick in. Okay, I'm not saying that is the cause in all cases for dementia. We've got quite a number of different types of dementia. That's a whole different type of topic. But in terms of vascular dementia, high blood pressure can actually contribute to that as well. So it's something we need to be mindful about in our day-to-day living. Now, remember we talked about it being a silent killer. Like I said, the symptoms, it's not always noticeable, okay? But if you do have symptoms, these are the ways it can manifest. For some people, they just think, oh, their vision is not quite straight. But guess what a lot of us do? Oh, it's just the stress I had from today. I'll just rest and I'll be fine. And then they get to the next day, oh, it's just work. And then we keep putting it aside. We don't even bother. I'm not saying call the doctor right there and then, but if you have the kit at home, you can actually check it and see, okay, what is my blood pressure like at the minute? Okay, but blood vision is something that can manifest in there. For some, it's headaches. They have headaches and they just blame it on maybe this migraine, assuming they're known to have migraines. And it's possible it could be migraines, but what if that headache is down to the pressure, in the head as well? So hypertension can manifest in that way. For some people, it's nosebleeds. We talked about the pressure. If with the pressure, the vessel is just trying to look for an outlet to just release and just relax a bit, that can manifest as a bleed, so as in nosebleeds. For some, they begin to have shortness of breath, but this is more of a complication. So say, for example, their heart has overworked, and then they start having issues trying to breathe. That is where shortness of breath can kick in. In some cases, we have it manifest as chest pain. People can have, I had a chap that came in last week, and literally we're just talking about chest pain and falling quite a lot. Like, he would just fall. His blood pressure he wasn't sure what his blood pressure was like, but he would just fall. And then we checked the blood pressure, and then it was pretty high. So yeah, chest pain. The chest pain doesn't have to be there all the time. But your body best. And that is why I try and tell my patients, don't ignore, listen to your body, okay? If there's a chest pain, that something different, you want to look into a bit more. Don't take it for granted. And dizziness as well is something else that could manifest as well, really, when your blood pressure is really high. For some people, they end up having bloodshot eye, but that is much more of an advanced one, really, in terms of the symptoms they can get. And the general advice here is, even if you feel fine, a healthy adult, once you're at that age from 40, the recommendation is to at least get your blood pressure checked once every 5 years. If you're healthy and, not using any medications, fit and well in yourself, the advice is to get it checked once every 5 years. If you want to check it annually, that is fine as a healthy person. If you're at an increased risk, we've talked about some of the risk factors already, haven't we? If you're at an increased risk, based on anything we've talked about, I think checking it once a year, it's not going to do you any harm, okay? So check it once a year as a bare minimum. Obviously, if you then flag, if it comes up that actually you've got raised blood pressure, then that is something that will need to be investigated at that point. So at least check it ideally once a year. So if you're a fit person, but based on things I've talked about, the risk factors, you are at an increased risk, I'd recommend just checking it once a year and, getting the all clear that it is fine. Life happens, different things changes, work, stress factors, exams, anything. So all of this could contribute, really. And for some people, they develop, especially with COVID hasn't really helped matters. And I don't want to blame a lot of things on COVID, but anxiety has increased dramatically with COVID. So my point is, if you're saying, she said we should check once every 5 years. Well, in these 5 years, some people have developed anxiety. So I'd recommend actually just check it every year as a minimum if you're at an increased risk and you're healthy, usually fit and healthy, okay? Now, in terms of the values you want to be looking out for, we've got the home blood pressure values. So when you check it at home, and that is what we've got here. In clinic, we have a different, just a slightly varied one. It's just, the difference is just minimal. But this is the one I want you to stick to, because if you check it at home, this is what would ideally like you to, the range would like you to be within. The idea is we've given that extra, or the guidelines have given that extra room, for some people that are generally just anxious, when you come and see a doctor, or just being in a clinical environment, in a hospital, in the GP surgery, some people just get just a little bit, worked up with that, really. So, but these are the values we want to be looking at. If you notice your blood pressure is getting lower than 90/60, you want to let someone know, as in medical attention, as in call your GP and book an appointment, speak to someone. Or if it's out of hours, you can always call 111 for that as well. But When it's less than that, at that point, we're talking about low blood pressure, which is not the focus today, really. But again, some people then have as well dizziness. Some of the symptoms could be similar, 120/80 is good. If you have more than 120/80, it is fine, as long as it's less than 135/85. Okay? For those under 80 years old. If you're over 80 years old, so if you're in a house and you decide you want to check all the adults' blood pressure, whilst you're, just pick a day in the year, you want to check everyone's blood pressure. We have a different value for the over 80s. Remember what I said about age being a factor, and this is a safe range that we're happy for anyone over 80 to be within. Anything less than 145/85 as per the current guidelines, and for those under 80 years old, anything less than 135/85. If you get anything higher than these values, you want to, I'm not saying panic, it could be a one-off. You might want to check and just keep an eye on it. That's if you don't have any of the other symptoms I talked about. If you have any of the other symptoms and a value that is higher than this, you want to get in touch with your surgery to let them know, okay? And like you said, this is something that we can treat, and we do treat in the community. So don't be scared about, oh, they'll send me to the hospital immediately. No, we just need to be able to work together to make sure we get that under control as much as possible. Okay, and obviously, there's also the aspect where, when it comes to patient responsibility, when we prescribe medications for you, but then you go home and then your salts, you're still eating as normal, your cholesterol intake is still high, you're not doing exercises. It's got to be a holistic approach, really, when it comes to managing this thing called high blood pressure. And it's also important for me to say that some people actually have what we call white coat hypertension. Okay, and what that essentially means is, so some people have white coat hypertension. What that essentially means is, for example, if you go into somewhere clinical, you already know. I'm not talking about you having a little bit of a raised blood pressure. People have it raised dramatically. But then when they get home, when they're in a non-threatening environment, the blood pressure is all normal. So it's important to be able to differentiate, really, to see if that's what you have. Say, for example, you've checked it at home and it's always fine, and then you happen to go to your GP and for whatever reason you go to your GP, we need to check your blood pressure, and then it comes up being really high. It could be a case of you go home and do it, you check it again, give us readings, and it could all be within a normal range. That would be called white coat hypertension. And it's something to be mindful. Again, listen to your body, observe yourself, and if that's your trend, make sure to let someone know. We might want to do a test to confirm. For example, we'll give you a blood pressure monitor for 24 hours. You do everything at home. You don't have to stay in any hospital. You go home, you go wherever you want to go. If you want to go and play golf, do whatever you would normally do. The blood pressure machine would record your blood pressure over a 24-hour period, and then we get to see the results of that. And if it's all normal, then at least we're reassured that, you know what, the value we got in clinic or in hospital were just one-off values because you've possibly got white coat hypertension. It's not common, but it's a possibility. Okay. So where can you get your blood pressure tested? At your GP surgery. Different GP surgeries have different ways of doing it pre-COVID, and some people might be restarting that, but you need to speak to your GP surgeries. 2 options within the GP surgery, actually 3. One, if it's during an appointment and that is something that comes up, then it can be checked there. Two would be if you call, and if that is a protocol they have at your surgery, where you can book an appointment with one of the healthcare assistants and they can do the blood pressure check for you. That is something that can happen. And another option, some surgeries actually have what we like machines. So they'll give you tokens. You usually do not need to pay for it. Give you tokens, you put that in the machine and you get your blood pressure tested, you get and then it sorts out your height and weight, and that is important, and we'll talk about why that is important very soon. So that is also another method really, but I'd say speak to your surgery, see what options they have if that is what you want to consider. Some pharmacies also would allow you to check your blood pressure. Again, find out which ones you've got around you and engage that way, really. See if they'll be happy, or if you need to book an appointment to get it done. But with the current times, if you can order the kit, just buy one kit for your house. And you can check it at intervals. Please, you don't need to sit down and check it every minute. Okay, there's no need to do that, but as and when needed, at least you have it in the house, and then you can always record your values. If it needs to be given to your GP, it's something that can be done electronically as well. So those are the options in terms of how you can get your BP tested. But out of all of this, just for like a routine check, if you can do it at home, I'd recommend that, okay? And then if obviously the values are high, then by all means, definitely get in touch with, a member of the medical profession. So whether that's through out of hours, as in 111, or calling your GP surgery for your routine appointment, okay? Now, practical steps really in terms of managing all of this. And I think one of the key things, I think we've touched on some of it already, but practical steps will be getting active. I know it's easy to say, but get active, exercise. And there's something I like to call habit stacking. So what that is say, for example, you like dancing. I know some of us do. You like dancing, you like playing that, music that, with some lovely beats. But the idea of going for a run, the idea of going for a walk, you're just not cut out for it. The truth is, you don't need to go out of your house to work out. You can actually do it within your house. So if you decide, okay, next 30 minutes, I'm going to dance, I'm going to do something that I enjoy, but I'm still achieving the real goal we want. So you put your good habits on top of what you really want to achieve. So in this case, I'd love you to exercise. So if that is by you dancing, then by all means, that is fine. If that's with you swimming, I recently found out one gym was offering aqua Zumba, for example, or even if you just want to go for aqua aerobics, get active, get moving. It actually helps a lot in terms of how you feel in yourself. Your diet, we've talked about that. Let's reduce the salt. Let's reduce the type of, pouring quite a lot of oil in a lot of our foods. Our caffeine intake, we need to be mindful of that. Alcohol intake as well. We need to make sure we keep to the recommended limit, which at the minute is 14 units. And this applies to both male and female. 14 units per week. And when we talk about 14 units, please don't down all the 14 units at once. The idea is to try and spread it out across the week and have breaks. So ideally 14 units with break days or days where you can have breaks intermittently. Losing weight, that is important. And actually, this is one that personally, I've actually seen patients that have done a mixture of losing weight and by being active in combination with their diets, and they're able to bring down that blood pressure level. and they can see the difference and they don't need medications. So, okay, so I can't overstress how important it is for you to, I can't overstress how important it is for you to consider losing weight. But when we talk about losing weight, I think it's also important for you to set targets, to understand what you're aiming for. And it's important for you to work out your BMI. And that is why I've put on this QR code. If you want to scan it, the idea is you get through to different, it will tell you to put in your weight and a number of other things, and then it can work out your BMI, which is what we use to actually clinically tell you if you're overweight, if you're clinically obese in different stages. All right. And what is good about this option, this particular website that I've got on here, is they then tell you ways you can get active. There's some apps you can engage with. There's a 12-week program as well you can engage with following that. So really, working out your BMI would be important. So at least you have insight into into what you need to be working towards when it comes to losing weight. Stress factors, we've talked about it. We don't want you to get, the gray hair, like you said. But realistically, though, I would love you to think of practical ways you can manage your stress factors. For some people, it's faith, being able to pray and then letting everything go. For some people, it's yoga. For some people, it's exercise, going on walks. Find something you can hold on to, or a range of things that would help with your stress factors. If you want to go for a massage session, go on holidays, whatever you enjoy that will help you bring that down, please, please, please try and look into that. Quitting smoking, we've talked about that. That would be the ultimate goal. There are options there. We've got a range of services that can support you in that process, really. So speak to your GP surgery about that. It's non-judgmental and it will just help you along the way. And this particular point about antihypertensives. Now, if you've got blood pressure, raised blood pressure as in hypertension, once we diagnose it as hypertension, it does not mean you immediately have to go on a medication, okay? But this depends on the values. Based on the values, we've got clinical ways we can stage it. So you hear things like stage 1 hypertension, stage 2 hypertension. Okay, now if it's within the stage 1 range, your doctor will let you know what stage it is, and you can ask them really. If it's within stage 1, generally, if you do most of these practical things thoroughly, generally we tend to see an improvement. But the issue is not everyone is able to keep up to that, and then they need medications as an add-on to supplement the whole process of reducing the blood pressure. But if it's within stage 1, we generally would not just throw medications at you. Would consider a number of things, but I'm happy to negotiate, see how things are with your lifestyle. We'll then review things again in a couple of weeks. But the thing is, and this is where a lot of people, sadly, when they do not engage, this is where the problem lies. So if, for example, I tell you, okay, in 4 weeks' time, we need to see or, come with your results, some people will not come back. And then I call, I chase up, and then no response. We need to take responsibility as well for our health as well. So I think if you're able to engage in both ways, you might not necessarily need medications long-term or even to get on it in the first place. But if it's at a higher stage and you have symptoms, then we'll need to consider giving you blood pressure medications to try and help you reduce that level. Now, if you're on medication, some people are on medications from their countries, and we don't necessarily prescribe those medications in the UK. And I've seen this happen over and over again. So problem that now happens is some people get dependent on people bringing the medications in for them. Problem one. So you don't have that continuity where your blood pressure is consistently under control, because you might run out and you're waiting for someone to fly out to bring some more in. There's also the other aspect, really, where people are using medications and they don't declare it. Or we prescribe certain medications and people are just not using it as they should. So these are all things you need to think about, take responsibility for your health, and actually engage really in trying to make sure there's a difference in what you feel and how you feel in relation to blood pressure. Right, and that brings me to the end of that. I've put up a question, a feedback survey on there if you're kind enough to complete it, but I'll go through your questions in details now, and I think I've covered some of them. Okay, so can it be cured? If we're in the stage 1 range, remember what I said about you taking in all the practical measures. If you're able to do that, then yes, it can come back within normal range. And then you know what? It's something you just need to keep a tight control over, the practical things. If, for example, you're having to now be on medications, generally it's a long-term thing. It's not curable as such. So there's no medication we'll give you that will cure blood pressure, but it will control it to be within a normal range. Having said that, there are people that tend to be on medications for quite a long period of time. And what we then begin to notice is they begin to go towards the other extreme, where it becomes hypotensive. So your blood pressure gets too low. People then have dizziness as well with this. They're passing out just like that. But when they stand up, they get dizzy or feel funny. So in that case, we'll then need to slowly titrate and reduce your current blood pressure medications. For some people, actually, this could be many years later though, but for some people, it might mean having to stop the medications because it's just too low at that point, okay? So it can go either way, but in terms of just giving you a medication that will cure it immediately, we don't have any. But to help you reduce it so you're in range every day, those are the options we have. Is it hereditary? Yes, we've talked about that. The main reason how we can prevent, I hope I've covered that already for you. What causes low heart rate or low pulse rate? What is the bad pulse rate? How do we manage low pulse rate? Okay, so for the pulse, really, Claire, that's not the subject for today, but I would touch on it briefly. So ideally, your pulse, when you feel, how fast you're, like literally on your wrist, you can just check it there. And for some of us, if you've got your smartwatches, it can tell you what your heart rate is. For some people, it can be really high, it can be really low. But in terms of really low, if you have any pulse rate that is sitting at less than, ideally we say 60 to 90 is like where we want to be, but we'll still ask if you get to a point of being 50 and less in your 40s, you definitely want to be escalating it urgently. And I mean speaking to your GP. For some people, there are some people that have just been trained, athletes, for example. So in terms of their pulse rate, it's just naturally lower. So those are things we need to consider. So I don't want you to just panic and say, oh, it's just so low. She said it will be XYZ. If that's been a process for you and you've got a professional, you've been trained in that way, such that your body is now acclimatized to a low heart rate, but not less than 50 though. Anything less than 50, you definitely want to escalate. But normally 60 to 90 is where we want to see it. 50 to 60, we would take. But if you're having symptoms, and the symptoms that comes with that, really main things we tend to see a lot of dizziness, or you stand up and then you want to pass out. We tend to see that in that case, so you definitely want to escalate. Visible signs, I believe we've talked about that. So yeah, but not everybody would have these visible signs. Can you stop taking BP medication once you're stable, given once, or become stable within given standard guidelines? I've only got 2.5 milligrams maintenance. I love how you said 2.5. Thanks for the question. I love how you said 2.5 milligrams maintenance. And that for me is evidence to let everyone know there are different medications. So I don't know what medication that is, and I'd be careful not to give personal advice on that. But in terms of your question, can you just stop? You'd need to engage with your GP for that. You should not stop on your own. No. I'd like to follow the trend. So if, for example, maybe we reduce one medication, assuming you're on 2 or 3 medications, we can decide to start with one medication, reduce it a bit, see the effect, reduce it a bit, see the effect, and then work it that way. So that is why I said you need to constantly engage. And then for some people, you might need to be on certain medications because of other medical conditions you have. But then that same medication helps with your blood pressure as well. So it's a conversation that needs to be had with your GP. But don't just stop it abruptly on your own. Please have that conversation and walk with them through the process. Going through the questions, stress can lead to gray hair, yes. How excess consumption of alcohol leads to high blood pressure. Okay. Ooh, there's a sound I'm hearing in the background. I don't know if we can mute everyone, please. Thank you. Okay, so excess consumption of alcohol, for me, it's 2 processes really. One process being the area around, we know how we talked about increased fluid, and that causing the pressure. But even more importantly, the body response to alcohol, you get really hyper. Again, for some people it's hyper, it's sober. In terms of your hormonal levels, everything, your endocrinology side of things get influenced by alcohol, okay? And then with alcohol, narrowing, this is the main key factor. Narrowing of your blood vessels. So assuming the normal size is like that, I don't know if, it's like that, and the blood has been flowing through. For some, alcohol then reduces the pipeway. And then you have the same volume of blood trying to force its way through, okay? It's that constriction that really has an impact, and then people have high blood pressure. I hope that clarifies that. But surgeries are refusing to see patients. It's not easy to get proper checkups at present. I hear what you're saying. Personally, I don't think it's that they're refusing to see. It's not that they don't want to see. If I'm being honest, the pressure on the system is a lot at the minute. I think it will be worth it in terms of just trying to even just do your blood pressure check. Try the pharmacy option. Okay, pharmacy, because you don't necessarily need to book in advance. Try that as an option. And if it comes up as being raised, because I take it that you want to get it checked with, a healthcare professional. If it comes up as being raised, then you can go back to your GP surgery and say, okay, I went to get this checked. They said the values were raised. Can I get an appointment, please? And these were the values. You need to give them the values. And then have that frank discussion with them and let them know the symptoms you're getting. But having said that, if you're having any of the other symptoms I mentioned, so headache, chest pain, shortness of breath, especially if it's out of hours, don't wait for your GP appointment. You can always call 111. So with 111, after they ask you, I know they need to ask you some certain questions. You go through the motion, which is important for them to triage you appropriately. If appropriate, then they hand you over to a doctor. We actually have GPs that are constantly on call all through the night, if it's a bank holiday weekend. So you actually have doctors, because some people think you just speak to non-medical professionals. No, it's a GP you speak to at the end of the line. So if you have it, please contact them that way, really. Okay. So you said, what if you're already hypertensive? I'm not sure what that question was in relation to. Can you please give a guide to ideal blood pressure reading, top and bottom? Ignore above the slide explaining. Great. What is the best kit we can buy? There isn't an actual, I can't name any particular brands, but generally it's not, for me, it's not about the brand itself. There are different ones out there. What would be useful is if you then decide, okay, maybe at least for the first one, after buying it, you might then want to take your blood pressure, and then also say you go to the pharmacy, find out their own values and see if you can, if it's the same, and then you're reassured it's the same. Some surgeries, I'm not sure about right now, but hopefully as we get through the COVID wave, I'm hoping things will ease up. Some surgeries offer facilities where they can try and calibrate it for you. If you're really worried that, oh, the reading is not right or something, call and ask if they can calibrate. But your pharmacies might be able to do it as well. But in terms of naming an actual brand, I can't do that. Portion control with diet, absolutely. Is hypertension reversible? I'm really hoping the bit about the lifestyle and, your diet control, all of that would help us realize actually we can, especially in the early stages, we can reverse it, but we need to put in the work for that to happen. But it's not something we go around saying, oh, we can just reverse it or cure it. We need to put in the work as individuals to make that happen. Thank you. You're welcome. What blood pressure medications do you recommend? So interestingly, I can't actually recommend any particular ones. And I'm not saying this because I'm trying to run away from the question. No, it's because we have certain protocols. So your own blood pressure medications might be different to your neighbors because you might have a different condition that I need to consider. For example, if you're a diabetic patient, there's a different pathway I need to be going through in terms of the medication I'm starting first. We've got our first line, second line, third line, fourth line, and all of that. So I have different medications based on the individual patient. So yes, that's one that would have to be decided by your GP based on your personal history. Okay. Thank you very much. You're welcome. Thank you so much. Is it true that when diagnosed as diabetic, doctor please let me know I'm doing for time. Hello, Anne.
Yeah, no, you're fine. You're fine for time. Yeah,
okay.
I was supposed to finish at 8:30, so yeah, you're fine for time.
Okay,
yeah.
Okay, great. Is it true that when diagnosed as diabetic, doctor considers prescribe BP medication, cholesterol together with diabetic medication, e.g. metformin? From what I understand, I'm not sure I fully understand the question, but I think you're trying to touch on what I've just said, as in if you're diagnosed as diabetic, yes, okay. The doctor will consider everything around your cholesterol levels, your diabetic, your HbA1c, your diabetes number for that. We need to consider that. So we don't just that, and that goes back to the question I answered before. It's not a one medication sorts it all out. We need to give you something specific. So as part of the workup, before I can even diagnose you with your hypertension and everything, I'd love to do, ideally we should be doing blood tests. And in that blood test, we get to find out what your cholesterol level is. That's one of the things, amongst other things we get to check for. So if your cholesterol level is high, we get to do a test, a Q-risk score. You don't need to know about that. We'll sort that out. And then it lets us know, actually, okay, you'll benefit from a medication to help your blood pressure, but also a medication to help that cholesterol level come down. Because if we don't give you that, you're at an increased risk of having, a cardiac incident, a cardiovascular incident in next 10 years. So we've got some sort of calculator that can work that out. So yes, we have to take into consideration your cholesterol levels, as well as a lot of other things, your actual medical condition, before we give you, a particular medication. In fact, it goes down to the current guidelines. It goes down to even down to ethnicity, because based on research, certain medications work best for, certain, if you're talking about Black Africans, for example, there's a certain one that works better as our first line, and then we can keep tweaking it based on your responses to that, okay? So yes, it's an individualized management for that. Can natural alternative replace BP medications effectively? I can't talk for natural alternatives. My thought is you're talking about like natural herbs and that. I can't talk about that. Everyone has different experiences with that. And as per the BNF, which I have to go by, you put like garlic. Okay, so it goes back to what I'm saying, that everyone has different responses to it. So what you might find working for you might not work for the other person. So see what works best for you. And this is where we need to be intentional to take time to understand our bodies. How much exercise per week is recommended for someone with high blood pressure? So generally the recommendation is 30 minutes for 5 days a week. So in a week, you want to be looking at 150 minutes of exercise. So 30 minutes over 5 days. So it's up to you how you choose to space it out. But like I said, I think you figure out I like dancing. So yes, dancing is a good one that can help with that as well. Thank you very much. Excellent presentation. Thank you. Can hypertension cause kidney failure? Yes, there's that link in terms of the risk factor. Yes, absolutely. There's a whole science to that, which is why we want people to keep on top of it, really. So yes, you teach dance as a result, see? And that's a good way of linking it up, really. You're teaching, again, back to habit stacking. You're teaching, you're doing something you enjoy, and you're trying to keep fit as a whole, really. So yes, great. Any more questions? I hope I've covered everything.
Yes, you've answered all the questions, Dr. Adeniji.
Thank you. Thank you very much.
Thank you so much. I think, this is part of a Community Champions program, which is basically helping us keep safe during this COVID period, whether that's kind of encouraging people to take the vaccine or just encouraging people to be safe, also helping people with GP registrations. And we were fortunate enough a couple of months ago in November, for Dr. Adeniji to give us a talk on how to get people registered with GPs. We still have some teething problems with that, but we're getting there slowly, really. The GP surgeries are not always kind of welcoming and accepting people without undocumented people, but we're slowly kind of working with them to get them to accept people. And each week we pass through a safe message, which I'm going to ask Kaushika to read out or to inform people about, and then we might call it an evening. But it's been a fantastic presentation, really, really informative. We've learned a lot, as I'm sure have other people. And we are definitely going to keep exercising. As Laurence mentioned, she's a dance instructor, and as part of United African Association's activities, we do a weekly Afro Moves exercise, which is kind of like dancing to Afro rhythms and stretching and exercise, and it's really good fun. So we do that via Zoom through the comfort of your own home. And I'll put the message
How can
on.
people engage with that then?
Yes, we do have on our UAA website, there is a link on there to the to how you can get on Friday evenings for the under 60s and on Sunday evenings for the over 60s. But it's really, really good fun, really good fun. And we hope more people can join, but we'll certainly put that on our website. And our website can be found on the leaflet that was shared that people attended to be part of this. So thank you.
And if there's a Zoom event, maybe we can share as well on
Absolutely,
ID
yes.
groups. Yeah,
Yeah.
I'd love to join in. I love dancing.
Absolutely, yeah. So Koshika, if you want to give the weekly message,
Yeah,
and then,
do you want to share? Yeah.
Oh, I haven't done it to on my email. So if you want, I suppose you could read it out.
Go into WhatsApp and yeah.
Yeah. And we're hoping that Dr. Adeniji is going to give us some more of these health sessions. There was a bit of a pause as one of the other doctors had kind of issues with the surgery, being overwhelmed with the booster vaccine. But we're hoping to continue these and probably ask Dr. Adeniji to give a few more health talks that are really valuable to us. We've made the recordings as well, which will make accessible to everybody that's joined. And if you can share that with your friends and colleagues, please.
Okay. So our can you hear me, Anne?
Yeah.
Okay. So our COVID weekly message, we've put it on the Ashadip groups. So from Monday 24th to Sunday 30th of January. So the main thing coming up on there is keep wearing your mask. Keep using hand gel on your hands, and then also the space. So make sure there's proper distancing, and then plenty of fresh air as well. Also booking the COVID and booster vaccination as soon as possible. But I think from 27th of January, so this is in a few days' time, the face coverings are not required by law, but I think we still recommend, for everyone to wear a mask in crowded and public spaces. And the other thing is you no longer need to work from home as well. And then for self-isolation rules, I think it's been sort of it's down to 10 days now. So day 0, symptoms appear or a positive test, the reason you need to self-isolate. And then day 1 to 4, so you start self-isolating and then start testing again on day 5. And then from 6 to 9 days, stop isolating if you get 2 negative tests in 2 days. And then day 10, stop isolating. And then the second part is we, the community champions, are here to support you. So the things that we can help you with, lateral flow test and how to use them, booking your COVID and booster vaccinations, getting NHS COVID pass as well, and then transport to get to a clinic. And if you need help in that way, if you contact community champions, and then we will sort of organize that for you. And then you can get LFTs from these sites. So Swan's Pool Center in Wellingborough, Monday to Friday, 9 a.m. to 4 p.m. Abington Park in Northampton, Monday, Tuesday, and Friday, 9 a.m. to 4 p.m. And then Market Square in Northampton, Wednesday and Thursday, 9 a.m. To 4 p.m. And I was lucky enough to be in Abington Park today. They're actually giving out family packs as well. So that lasts quite a few days, so yeah. Okay, so I've done that now, Anne. Okay. And oh yeah, they've got, for more information, it's Anne, Pedro, and Deepa, and I think we've got myself and also Ashok Pai as well. So we'll have our numbers on there as well. Okay, that's it, Anne. Thank you.
Brilliant. Thank you so much, everybody. Thank
You're
you very
welcome.
much, Dr. Adeniji, for that fantastic presentation. And thank you, everybody, for coming along. And hopefully everybody's learnt something at least. Thank you and have a good night. Bye.
Night, everybody. Thank you very much, Dr. Adeniji.
Bye.
Bye-bye.